Hello? Hello?
खाली बसून सरस्वती पूजन करणार आहेत का? जाताना सरस्वती पूजन आणि नंतर स्टेजवर जाणार आहेत.
Hello? Hello, I welcome all of you to this second international conference. झालं. Hello, a very good morning to all the dignitaries and participants. I am Professor Snehal Durande, host for International Conference, and I am extremely overwhelmed to have this opportunity to address you all at this international conference. Thank you to everyone for being here with us. I welcome you all to the first day of 2 days international conference on innovations in pharmaceutical and life sciences, bridging a classical knowledge with modern technologies, organized by Dattakala Sanstha's dignitaries to please occupy the dais. A very good morning to all the dignitaries and participants. I am Professor Snehal Durande, host for this international conference, and am extremely overwhelmed to have this opportunity to address you all to this international conference. Thank you to everyone for being here with us. I welcome you all to the first day of 2 days international conference on innovations in pharmaceuticals, life and forensic sciences, bridging a classical knowledge with modern technologies, organized by Dattakala Sanstha's Dattakala College of Pharmacy and Dattakala Institute of Pharmaceutical Science and Research, Swami-Chincholi, in association with affiliated universities, Savitribai Phule Pune University, Pune, Dr. Babasaheb Ambedkar Technological University, Lonere, Indian Pharmacy Graduate Association and IPGA Welfare Trust, New Delhi, and Association of Pharmaceutical Teachers of India, Maharashtra. It's my privilege to welcome Honorable Professor Ramdas Jol Sir, Founder President of Dattakala Shikshan Sanstha, Honorable Mrs. Kaushalya Devi Jagtap Madam, Vice President of Dattakala Shikshan Sanstha, Honorable Mrs. Maya Jol Ma'am, Secretary of Dattakala Shikshan Sanstha. It's my privilege to welcome our chief guest, respected Dr. Atul Kumar Nasa Sir and respected Dr. Dipendra Singh Sir. I would also like to welcome our resource persons, Dr. Chan Siok Imam and Dr. Eng Wok Wen Sir, Dr. Vijay Kotra Sir, respected Dr. Ravindra Kontham Sir and respected Dr. Venkateswara Rao Sir. I also welcome Honorable Dr. Vishal Babar Sir, Chief Administrative Officer of Dattakala Shikshan Sanstha and Principal of Dattakala College of Pharmacy, Honorable Dr. Jyoti Javle Ma'am, Principal of Dattakala Institute of Pharmaceutical Science and Research, Honorable Dr. K. Srikant Sir, Convener of this international conference, Dr. H.D. Jedge Sir and Professor Amit Ponkule Sir, coordinators of this international conference. I would like to welcome all the evaluators for the oral and poster presentations. Additionally, I would like to extend a hearty welcome to the principal, faculties and research scholars from the other colleges. I would also like to welcome all the press and media members. Last but not least, I also welcome all the participants from the various colleges all over the India. Then I request all the dignitaries or all of you to stand for the national anthem. Thank you. All of you please be seated. Then we have a felicitation ceremony. Atiti Devo Bhava, which means the guest is God, is a tagline of India's culture that emphasizes treating a guest with respect and hospitality. Therefore, we will be honored to felicitate our guest. So, I welcome Dr. Vishal Babar Sir to felicitate and welcome our Dattakala Shikshan Sanstha's founder president, Honorable Professor Ramdas Jol Sir and Secretary Mrs. Maya Jol Ma'am. sir. Now I request respected Honorable Professor Ramdas Jol sir and Jol ma'am to felicitate and welcome our chief guest, respected Dr. Atul Kumar Nasa sir. Thank you, sir. Now, I request respected Honorable Professor Ramdas Jol sir and Jol ma'am to felicitate and welcome our guest of honor, respected Dr. Dipendra Singh sir. Thank you, sir. Now I request respected Honorable Professor Ramdas Jol sir and Jol ma'am to felicitate and welcome a resource person, respected Dr. Chan Sioki ma'am. Thank you. Now I request respected Honorable Professor Ramdas Jol sir and Jol ma'am to felicitate and welcome resource person Dr. Eng Ok Wen sir. Thank you, sir. Now I request Honorable Professor Ramdas Jol sir and Mrs. Maya Jol ma'am to felicitate and welcome resource person, respected Dr. Vijay Kotra sir. Thank you. Thank you all of you. Let me introduce you all to the Dattakala Shikshan Sanstha. The Dattakala Shikshan Sanstha was established in 2009. Here we are providing many courses for our students like pharmacy, engineering and management. We are having 4 pharmacy colleges. The first one is Dattakala College of Pharmacy, which offers diploma in pharmacy, B Pharm and M Pharm. In M Pharm, there are various branches like pharmaceutics, pharmaceutical chemistry, pharmaceutical quality assurance, pharmacognosy and regulatory affairs. The second one is the Dattakala Institute of Pharmaceutical Science and Research, which offers diploma in pharmacy, B Pharm, M Pharm and M Pharm. In M Pharm, there are various branches like pharmaceutics, pharmaceutical quality assurance and regulatory affairs. The third college is Anusaya Institute of Pharmacy, which offers diploma in pharmacy. Then the fourth college is Dattakala Institute of Pharmacy, Ketur, which also offers diploma in pharmacy. For the engineering and management, we are having Dattakala group of institutions. For polytechnic diploma, we have various courses like computer engineering, information technology, mechanical engineering, electrical engineering, civil engineering, electronics and telecommunication engineering. For the degree engineering, we have computer engineering, civil engineering, mechanical engineering, information technology, artificial intelligence intelligence and data science, electronics and computer engineering, and electrical engineering. For the masters in engineering, we have courses like machine design, electrical engineering, computer engineering, structure design, and Internet of Things of engineering. Then we also provide BBA, BCA, MBA, and MCA courses. Dattakala Shikshan Sanstha also provides schooling through the Dattakala International School and Junior College having an SSC and CBSE board, and Dattakala Ideal School and Junior College Kettur has an SSC board. There are also hostels and mess facilities for the students in this campus. So this is all about our Dattakala Shikshan Sanstha. Now I request Dr. K. Srikant sir, convener of this international conference, for the opening and welcome speech.
Good morning to the respected management, Chief Administrative Officer, all the chief guests and resource persons, and my dear participants. Very good morning to one and all. As a convener of this event, it's my privilege to welcome you all for the 2 days international conference organized by Dattakala Shikshan Sanstha's Dattakala Institute of Pharmacy and Dattakala Institute of Pharmaceutical Science and Research in association with SPPU, DBATU, and effective professional bodies like IPGA and APTI, and Dattakala Shikshan Sanstha providing quality education for the students through diploma courses, bachelor degree courses, master degree courses in pharmacy, engineering, MBA and MCA. Dattakala Shikshan Sanstha also providing quality education to children through the SSC, CBSE schools and junior colleges. So today for the international conference, totally 822 participants were registered for this international conference from more than 105 pharmacy and life sciences colleges across India, including both offline and online. And nearly more than 110 students requested for the accommodation for the 2 days. And I would like to thank all the other college principals and faculty members for their support in providing this much huge registrations. And I hope all the participants will be benefited with the conference sessions and plenary lecturer sessions and poster and oral presentations. I wish you good luck and all the best. Thank you.
Thank you, sir. Now I kindly invite Dr. Jyoti Zawle ma'am, Principal of Dattakala Institute of Pharmaceutical Science and Research, for the welcome address.
Very good morning to all of you. I, Dr. Jyoti Zawle, heartily welcome to all the respected management of Dattakala Shikshan Sanstha, Honorable Ramdaji Zor sir, Founder President of Dattakala Shikshan Sanstha, Honorable Mrs. Kaushalya Devi Jagtap, Vice President of Dattakala Shikshan Sanstha, Honorable Mrs. Maya Zor Madam, Secretary of Dattakala Shikshan Sanstha, respected Dr. Vishal Babar sir, Chief Administrative Officer of Dattakala Shikshan Sanstha, all the guests, eminent resource persons and participants. I express my gratitude to affiliated universities that are Swami-Chincholi Pune University, Pune, Dr. Babasaheb Ambedkar Technological University, Lonere, and also professional bodies that are Indian Pharmacy Graduate Association and IPGA Welfare Trust, New Delhi, APTI-Maharashtra State Branch, for their effective collaboration and support in organizing this event. We have eminent guests and eminent speakers from in and outside the country for this international conference. I can surely say that you will be benefited with these 2 days sessions, and I wish you all the best. Thank you.
Thank you, ma'am. Now I request Dr. Vishal Babar, sir, Chief Administrative Officer of Dattakala Shikshan Sanstha and Principal of Dattakala College of Pharmacy to address and guide our participants.
Very pleasant good morning to one and all. I am very much thankful to the management of Dattakala Shikshan Sanstha's founder president Professor Ramdas Joe sir and Secretary Honorable Mrs. Maya Zoor madam for their unbelievable and unconditional support in conducting this international conference. My heartfelt thanks to Chief Guest Dr. Atul sir and Dr. Dipendra Singh sir and their all other dignitaries. My deepest gratitude to all resource persons, Dr. Chand ma'am, Dr. Ang sir, Dr. Vijay sir. I congratulate to Dr. Jyoti Javade ma'am, Organizing Secretary, Dr. Shrikant, convener of this event, and all other coordinators, Dr. J.K. sir and Professor Amit Punpule sir, of this event and their interest in organizing international conference. I wish this Tuesday's international conference will be grand success. Thank you all of you.
Thank you, sir. So, today we have a eminent chief guest. Now, I request Professor Alpha Jain ma'am to introduce our chief guest, Dr. Atul Kumar Nasa, sir.
Alpha Jain welcome you all on this two-day international conference which is held at Dattakala Shikshan Sanstha, Dattakala Group of Pharmacy. I would like to introduce our today's inaugural chief guest, Dr. Atul Kumar Nasa sir. Welcome sir. Sir is currently serving as a Pro Vice Chancellor at SGC University, Gurugram. Sir has completed B.Pharm in 1983 from University of Delhi, M.Pharm in 1986 from University of Delhi, and holds a PhD in Pharmaceutical Chemistry from MIT University, Noida. And sir holding various certifications also. Sir is currently working as Pro Vice Chancellor at SGT University, Gurugram, and having more than 40 years of professional experience spanning with industries, academics, regulatory affairs, administrations, and so on. Earlierly, actually, sir is the head of Officer and Controlling Licensing Authorities in Drug Control Department under Government of NCT of Delhi, where he plays an key roles in enforcement of major pharmaceutical laws, which includes Drug and Cosmetic Act 1940, Drug Price Control Act 2013, Medical Devices Rules 2017, New Drugs and Clinical Trials in 2019. Sir is the member of Drug Technical Advisory Boards under the Ministry of Health and Family Welfare, Government of India. Sir has contributed significantly in the policy making and regulatory committees. Sir is actively participated in the assignments by the Pharmacy Council. Sir has published number of research papers at national and international levels, and sir is a life member of several prestigious professional organizations which include International Pharmaceutical Federations, IPGA, IPA, IPTA, IPHA, Indian Society of Cognosis. Sir has represented India in the international conference such as International Pharmaceutical Federation in 2013 in Dublin, 2018 in Glasgow, and 2019 in Abu Dhabi. Sir having the leadership and dedication. So sir has elected as the Indian Pharmaceutical Association in 2013 and Currently, sir is the president of Indian Pharmacy Congress graduate and holds up positions in professional bodies which includes Indian Confederations of Healthcare Accreditations, Indian Drug Control Officers Confederations. Sir has received numerous prestigious awards which include Best Drug Control Officer Award in 2017, Outstanding Young Professional Achievement Award in 2003, Best Drug Inspector Award in 2001, Fellowship of IPA KG Chatterjee Memorial Award in 2015, IPGA Professional Excellence Award 2015, Best Alumni Award and Regulatory Person of the Year Award in 2009. This remarkable journey reflects unwavering dedications, strong leadership qualities, and immense contribution towards the achievement of uplifting the professional of the pharmacy at the national and international level. So we are very eager to listen you, sir. So I hand over the session to you, sir. Thank you.
Hello. Hello. Good morning. Thanks a lot for a nice introduction. On the dais, Professor Ramdas, Mrs. Maya John, Dr. Jitendra Singh, Dr. Jyoti Principal, Dr. Shrikant Principal, Dr. Vishal, our resource person Dr. Chen, Dr. Foy, Dr. Vijay, faculty members and dear students. सबसे पहले I am highly thankful to the management of this institute and the principal of the pharmacy colleges for calling me all the way from Delhi to this city of Pune. Today was a working day for me, पर मैं इनको मना नहीं कर पाया and I said I will definitely come. This 2 days international conference on innovation in pharmaceutical, life and forensic sciences, bridging classical knowledge with modern technologies, organized by Dattakala Sanstha along with Dattakala College of Pharmacy and Dattakala Institute of Pharmaceutical Sciences. My complete biodata that young student has read. But I tell you, the more than 40 years of my journey, right from pharmaceutical industry in 1983, in pharmaceutical education from 1986 to 92, and then into drug regulation in drug control department from 1992 to 2022, 30 years. And then back to academic as a pro-vice chancellor. It was a tough journey. It was a challengeable journey. but at the end of the day, I always say it was a successful journey. Why I am sharing this? क्योंकि यहाँ पे most of the and I tell you, such a nice profession. I can say you have taken a right decision at a right time by choosing right profession as a career. That is the pharmacy. But if I go back, I tell you, I never wanted to become a pharmacist. And I share my journey. 1977. I passed my matriculation examination 10th degree, and that also was in Hindi medium, not in English medium. That was the first batch when in India 10+2 scheme was started. Earlier it was 8+3. First time in our country 10+2 scheme was started in 1977. My batch was the first batch. And government has declared that after passing 10th class matriculation examination, you can get admission in diploma courses, in polytechnics, in pharmacy colleges. So somebody told me why to go for 11th and 12th class, why not to choose pharmacy as a profession and get admission in diploma in pharmacy course. And completed my diploma in pharmacy at the age of 17 years in the year 1979. And a situation came, I was not adult, 18 साल की एज होनी चाहिए. I went to Delhi Pharmacy Council for registration. They told minimum age is 18 years for registration. I went to employment. I applied for Bachelor of Pharmacy lateral entry course. Age is 18 years. Now see a situation, completing diploma in pharmacy at the age of 17 years with a big question mark. अब आगे क्या करें? अडल्ट भी नहीं है, 18 साल की एज भी नहीं है, क्वालिफिकेशन भी है, कैबिन शॉप में नहीं खोल सकते, रजिस्ट्रेशन भी नहीं है. सोचा कोई नहीं, 1 साल वेट करते हैं. Waited for 1 year. Simultaneously I did my intermediate from Madhya Pradesh भोपाल. और उन्हीं दिनों एक पार्ट टाइम फार्मासिस्ट का वैकेंसी निकला in one of the college in Delhi in medical room. ₹200 per month was the salary. तो मैंने सोचा ये भी कर लेते हैं. तो started my first job at the monthly salary of ₹200 per month. इंटरमीडिएट किया, 18 साल की एज हुआ, बैचलर ऑफ फार्मेसी में एडमिशन लिया, फिर पीछे मुड़ के नहीं देखा. This is how I started my journey as a pharmacist. India, since I belong to a regulating department, 30 साल में जॉब किया. I always say India is the pharmacy of the world. Today, 60% of our formulations, vaccines, we are exporting to the entire world. आप सबने पेंडेमिक का टाइम देखा, and during pandemic time, when the second wave came, lot of kids, lot of demand for blood and so on, and people were dying. And at that time, I was heading the drug control department of Delhi, the capital of India. Such a tremendous pressure I have seen in the year 2021 when this pandemic came. And there was a huge demand of life-saving drugs, including remdesivir injections, tocilizumab injection, cases of black fungus, mucormycosis, demand of amphotericin B injection, and so on. Such a challenge. And there was a call from the Office of Prime Minister of India, Modi ji, that India don't have any vaccine to treat COVID. Thanks to two companies, one from here Pune only, Serum Institute of India, and second from Dr. Krishnella Bharat Biotech. They developed two molecules, Covaxin and Covishield, and we saved the entire world. That was from my department. Why I am sharing this? In any of the industry, recession can be there. But remember, in pharmaceutical industry, there cannot be any recession. In medical devices industry, there cannot be any recession. And once these industries are on the growing side, job opportunities for all the young pharmacists sitting here, it is always on the higher side. You can start your career after pursuing your pharmacy course in pharmaceutical industry, in manufacturing department, in quality control department, in quality assurance department, in research and development section, in hospital pharmacy, in community pharmacy, in clinical pharmacy, in clinical research organizations, in academics, in regulations, and so on. Choice is yours. But only sincere advice to all the students sitting in this audience: never stop your career after undergraduation. After passing a Bachelor of Pharmaceutical Sciences course, you must go for higher studies. It can be Master of Pharmaceutical Sciences in any of the specialization, whatever you feel like. It can be combination of Bachelor of Pharmaceutical Sciences with MBA. It can be combination of Bachelor of Pharmaceutical Sciences with LLB, and so on. Choice is yours. But always go for higher studies, at least some PG degree, which will definitely pay you in the long run. This is sincere advice to all the young pharmacists sitting in this audience. Challenges. I tell you what are the challenges. It is a competitive environment. Time has come that artificial intelligence. अभी recently एक summit हुआ दिल्ली में, एक summit, and all of the universities and so many people from the world, they participated in that summit of artificial intelligence. Artificial intelligence is definitely playing an important role in the drug discovery, in the new drug development, in the repurposing of drugs, and so on. But remember, artificial intelligence cannot overrule the human mind. At the end of the day, it is the human mind which has to work for the professional organization and professional growth. This is the role of the pharmaceutical industry. I always talk the role of pharmacists in different sectors. Antimicrobial resistance, AMR, is on the rise. Antibiotics are not effective. The AMR policy is well in place by the government of India and by all the hospitals. But antibiotics are to be used judiciously. This is the role of the pharmacist in preventing antimicrobial resistance. Challenges: increase in the lifestyle disease. I tell you, WHO has given a data that most of the young generation, 50% of them are suffering from diabetes or they are suffering from hypertension. And challenges, cancer rise. So we pharmacists are the important player of healthcare system. We have to see how to prevent this lifestyle disease by educating each and everyone, including ourselves. Our lifestyle should be such a way. I tell you one example. I attended one of the conference of Dr. K.K. Agarwal, who was leading cardiologist. During his conference in the cardiology department, he told, अगर हमारे को पूरे दिन में 30 to 35 minutes to 45 minutes का अपने तकिए के साथ लेके सोते हैं, और जब सुबह उठते हैं ना मॉर्निंग, अर्ली मॉर्निंग, सब कुछ भूल जाते हैं, पहले मोबाइल में देखते हैं कि इसमें कौन सा मैसेज मिस हो गया। दिस एडिक्शन is to be prevented. This is such a dangerous, issue कि अगर हम इसके ऊपर कंट्रोल नहीं करेंगे, things will not be on the better side. So we have to stop all this lifestyle disease. तो डॉक्टर के अग्रवाल ने क्या बोला, अगर आपको 30 मिनट्स का टाइम नहीं है in any of the building जहाँ आप रहते हैं, in any of the institute जहाँ आप पढ़ते हैं, in any of the organization जहाँ आप जॉब करते हैं, never use lift. Go by stairs, come by stairs. That is the best exercise you can do. जिस दिन मैंने उनका वो लेक्चर सुना डॉक्टर अग्रवाल का, I tell you, my department of health in Delhi सचिवालय was on 9th floor. और मैंने सोचा लिफ्ट यूज नहीं करनी, and I used to go to 9th floor by stairs, come by stairs. I tell you, I am 64 by age, but by the grace of God, there is no lifestyle disease. This is why I am sharing कि आपको एक इम्पॉर्टेंट फ्रेज है, हेल्थ इज वेल्थ. अगर हेल्थ नहीं है तो कुछ भी नहीं है. ये आपको समझना है अपने लिए, अपने पेरेंट्स के लिए, अपने फ्रेंड्स के लिए, अपने दोस्तों के लिए कि यू हैव टू मेंटेन हेल्थ. अगर आपकी हेल्थ ठीक रहेगी, automatically the health of the entire community and health of the entire population in the country will be on the best side. So this is the role you have to play in a healthcare system. सबसे बड़ा चैलेंज आया ड्रग एडिक्शन, ड्रग एब्यूज. आपने एक मूवी देखी होगी उड़ता पंजाब, नाम सुना उड़ता पंजाब? In that उड़ता पंजाब, which is a reality, most of the young generation of the Punjab is under drug addiction. Drug Control Department of Punjab government has issued an advisory that nobody can sell codeine preparations, Corex, Felicitations, and all hypnotic and sedatives and tranquilizers. बड़ी स्ट्रिक्टनेस किया गया to prevent this drug addiction. एक और मूवी आया था, अगर आपको ध्यान होगा, संजू. In that Sanju movie, Sanjay Dutt is taking a white powder. उसका फ्रेंड बोल रहा है ये ग्लूकोज आप खा लीजिए, but it was not glucose, it was a drug. So remember, as a pharmacist, you have to see how this drug addiction is to be prevented. You have to play an important role in avoiding this drug addiction. And lastly, challenge is self-medication. आज की डेट में सेल्फ मेडिकेशन एक बहुत बड़ा चैलेंज है. वी नेवर वांट टू गो टू ए डॉक्टर क्योंकि वहाँ पैसा देना पड़ेगा. इफ एनी स्मॉल बॉडी एलिमेंट इज देयर, वी स्टार्ट टेकिंग मेडिसिन ऑफ आवर ओन इंक्लूडिंग एंटीबायोटिक्स. दैट इज टू बी प्रिवेंटेड. सो इन ऑल दिस ड्रग एडिक्शन, सेल्फ मेडिकेशन, एंटीमाइक्रोबियल रेजिस्टेंस एंड इन लाइफस्टाइल डिजीज, all of you have to play a very important role as a pharmacist. Whenever I go to any of the conference, I always say there should be industry-academia interaction. अगर industry-academia interaction नहीं है, तो your placement, your internship will not be there. So my sincere advice to the management also, try to have some bonding with the industries in your area, maybe pharmaceutical industry, cosmetic industry, diagnostic industry, medical device industry, and try to see that students are getting the internship or training in the relevant industry from time to time, and also constitute and in that industry advisory board, both the principals sitting here try to have some experts from the concerned industry. Invite them on monthly basis to deliver a talk to the pharmacy students, what they want from the pharma students, what are their expectations, what is the expectation of the industry. Very strong, and it should be helpful to the pharmacy student for getting the placements and training and internship. So, bonding of IAD is very, very important. Teaching. I tell you, teaching is a noble profession. It is a very respected post, very respected post. And perception for teacher is always on the higher side. But I have seen the teachers, they have got good knowledge of their subject, they know the subject, but they are not able to communicate. So a good teacher is that teacher who communicates in such a way. आज की जो teaching pedagogy है, teaching pedagogy has now is totally different away from classrooms. It is a time of experiential learning. So try to see how the educating teacher sitting here to involve the student for experiential learning by giving some project. And just to conclude, I tell you, I am the president of Indian Pharmacy Graduate Association and also the member of Pharmacy Council of India. At PCM, Dr. Devendra Singh will be also giving some details. We are trying our level best to streamline all the situations and try to see that all the institutions in the country should be well educated, well guided with different policies and guidelines of Pharmacy Council of India. And 75th Indian Pharmaceutical Congress, 75th IPC, is now going to be held this year in the month of December at New Delhi, being hosted by Indian Pharmacy Graduate Association, IPGA. So, being the national president of IPGA, I of the month of December. Dates will be announced very shortly, maybe second week or third week of December, and participate in IPGA. And also I will request the principal of both the colleges that you can start IPGA local chapter at your Dattakala Institute or at this belt, making IPGA very strong. And lastly, जो मैंने लाइफ से भी सीखा, पॉजिटिविटी, humbleness, always peace. मेरी लाइफ में मैंने बताया बहुत चैलेंजेस आए, पर पॉजिटिव चले. For positivity there is no end, no end. But for criticism it is very easy. मेरे को किसी को भी क्रिटिसाइज करना है, it will take one time. पर किसी को appreciate करना है, it will take lot of thinking. इसको मैं क्योंकि टाइम क्या कंपटीशन का टाइम है, जेलिसी सेल्फ सेंटर्ड है कि मेरे से ज्यादा, वो एक कहावत है ना, लोग अपने दुख से ज्यादा दुखी नहीं है, अपने सुख से दुखी. तो वो पॉइंट, रिस्पेक्ट आपकी अपने हाथ में. आई टेल यू व्हाट इज योर रिस्पेक्ट. रिस्पेक्ट इज दैट रिस्पेक्ट व्हिच इज नॉट इन योर प्रेजेंस. Respect is that respect which is in your absence. People should talk about you positively in your absence. That respect you have gained. उसका एक छोटा सा एग्जांपल लेके मैं कंक्लूड करूँगा. I never wanted to join drug control department. मेरा पैशन टीचिंग का था. My family is a teaching family. My father was a principal. My mother was a principal. We are three brothers. तीनों की wife teacher है. And I was also teacher in Lady College. Destiny वहाँ ले गई drug control department में in 1992. That story I will not share, but I tell you when I was appearing in the UPSC examination, हमारा selection UPSC से था, and it is the toughest body for selection. So when I appeared in the UPSC, 3 subject expert from pharma. While still I remember Professor Swami-Chincholi from Voltaire University, Andhra University. He is no more nowadays, but very intelligent pharmacist. And one UPSC chairman and one nominee from Government of Health. आधा घंटा 40 मिनट मेरा इंटरव्यू हुआ in UPSC with lot of questions from pharma. I answered all questions very confidently. और मन में ये था कि पढ़ा तो रही है, कॉलेज ऑफ फार्मेसी में जॉब तो लगी हुई है, अगर सिलेक्शन होगा होगा, नहीं होगा नहीं होगा। आई अपीयर फ्रॉम दैट माइंडसेट। एंड जैसे 40 मिनट के बाद मेरा इंटरव्यू खत्म हुआ तो मिस्टर चकवाल जो चेयरमैन थे, ही टोल्ड मिस्टर नासा यू कैन गो। और जैसे मैं उठ के बाहर डोर की तरफ जाने लगा, उन्होंने मुझे दोबारा बुलाया, कहने एक बार वापस आ गया। अब हमने सोचा व्हाट नेक्स्ट, इतना क्वेश्चन पूछ लिया, 40 मिनट का इंटरव्यू हो गया, अब क्या रहेगा। उन्होंने हमसे पूछा, हम एक क्वेश्चन पूछना भूल गए आपसे, आप बैठिए, मैंने बताइए सर। यू आर होल्डिंग ए रिस्पेक्टेबल पोस्ट ऑफ टीचिंग, परसेप्शन फॉर टीचिंग इज ऑलवेज गुड, यू वांट टू बिकम ए ड्रग इंस्पेक्टर एंड इंस्पेक्टर मीन्स करप्शन, perception is not good. Give one specific reason why you want to leave teaching job and why you want to join drug control department, which is not a respectable post in the eyes of public. It was presence of mind. God was there. I told sir, वो बोले बहुत डिप्लोमेटिक आंसर है, मैंने नो सर दिस इज द रियलिटी, यू हैव टू कमांड द रिस्पेक्ट। और जब मैं यूपीएससी के रूम से बाहर निकला, एक इंट्यूशन हो गया कि शायद सिलेक्शन हो गया। एंड व्हेन द रिजल्ट केम, आई वाज यूपीएससी टॉपर। व्हाई आई एम शेयरिंग दिस, कि जितना आप रिस्पेक्टफुली हम्बलनेस से बात करेंगे, आप डेफिनेटली ग्रो करेंगे। जहां आपने ईगो किया लाइफ में, आप बिल्कुल डाउन आएंगे। सो लाइफ का एक प्रिंसिपल लाइए कि ईगो नहीं करना है, टॉप पे रहना है, सब कुछ मेरे को करना है, और जो मेरा एम्बिशन है, जो मेरा एम है, जिसको ये मैंने फार्मेसी प्रोफेशन को चूज किया, वो डेफिनेटली फुलफिल हो, यही मेरा विश होना चाहिए। और अब्दुल कलाम जी ने क्या बोला, हमारे प्रेसिडेंट थे अब्दुल कलाम जी, नाम सुना आपने, बहुत इंटेलिजेंट थे। उन्होंने एक ही बात बोली कि जब आप सुबह अर्ली मॉर्निंग उठते हैं, अर्ली मॉर्निंग, 5 चीजें आपने ध्यान रखनी है, 5 थिंग्स, और वो बोलनी भी है। और सबसे पहले आपको ये बोलना है, मैंने बोला आई एम दी बेस्ट। क्या बोलेंगे, जोर से बोलिए, सभी बेस्ट ने ध्यान रखिए। कोई ऐसा नहीं, किसी को कॉम्प्लेक्स नहीं होना चाहिए कि वो मेरे से हाईली क्वालिफाइड है, इंटेलिजेंट है। अगर आपके दिमाग में ये आ जाएगा कि आई एम दी बेस्ट, आप बेस्ट ही होंगे। सेकेंडली आप बोलेंगे नथिंग इज इम्पॉसिबल। क्या बोलेंगे, कोई चीज ऐसी जो पॉसिबल ना हो। हमने कोवैक्सीन भी दिया, हमने कोविशील्ड भी दिया, हमने कोविड टाइम भी देखा, हमने हार्डवर्क भी किया, हमने इम्पॉसिबल को पॉसिबल करके दिखाया और पूरे वर्ल्ड को वो वैक्सीन दिया। तो सेकेंडली बोलेंगे नथिंग इज, थर्डली बोलेंगे आई कैन डू इट। क्या बोलेंगे, आप सब कुछ कर सकते हैं, कंडीशनली विलिंगनेस हो, और विलिंगनेस नहीं है तो कुछ भी नहीं होगा। चौथा आप बोलेंगे गॉड इज विद मी। क्या बोलेंगे, क्योंकि गॉड हेल्प दोज हु हेल्प देमसेल्व्स। अगर आप भगवान को मानते हैं, हर चैलेंज पे गॉड विल सपोर्ट यू कंडीशनली, योर कॉन्शियस शुड बी क्लियर। एंड लास्टली यू विल स्पीक टुडे इज माय डे। क्या बोलेंगे, आज आपका दिन है कि नहीं है। कैसे है मैं बताता हूँ। इतने डिग्निटीज यहाँ बैठे हैं, रिसोर्स पर्सन बैठे हैं, आपको मेरे बारे में मालूम हुआ, डॉक्टर दीपेंद्र के बारे में मालूम होगा। एंड अटेंडिंग दिस कॉन्फ्रेंस आई टेल यू मीट सो मेनी पीपल। आप लिंक्डइन पे जाइए, आप फेसबुक पे जाइए, आप सोशल मीडिया पे जाइए, उनका प्रोफाइल पढ़िए, उनकी सक्सेस जर्नी पढ़िए। डॉक्टर पंकज पटेल की प्रेसिडेंट और CEO ऑफ जाइडस कैडिला, ही इज ए फार्मेसी ग्रेजुएट। आज जाइडस कैडिला कहाँ पहुँच गई, आप उनकी सक्सेस स्टोरी सुनिए, हाउ टू रीच टू दैट लेवल। So this is the life. So with these remarks, my best wishes to each and everyone and all future pharmacists sitting in this hall for your better future. And once again, sincere thanks to the management and the principal of Dattakala Institute for inviting me to this conference as a chief guest. Thank you very much.
Thank you so much, sir. Dr. Dipendra Singh, sir.
Good morning everyone. I, Alisha Sheikh, on the behalf of the Dattakala Sanstha, it gives me immense pleasure to welcome It's not just the gathering of experts. It is the platform where traditional scientific foundations meets innovation and where quality meets responsibility. It's my privilege to introduce our valedictory chief guest, Dr. Dipendra Singh sir. He is currently serving as a professor at the University Institute of Pharmacy, Pandit Ravishankar Shukla University, Raipur. He is a Central Council member and chairman of the Education Regulation Committee, Pharmacy Council of India. He has received the highest acclaim as being featured among the top 2% scientists across the world in the field of pharmacy and pharmacology for 5 years from 2020 to 2025 by Stanford University, USA. He has around 21 years of teaching and research experience. His prime research area includes formulation of multiple bioactive delivery systems, strategies for wound management, advanced statistical and mathematical modeling methods, and designing novel systems for plant actives and extracts. He has more than 150 research and review papers, 40 book chapters published in national and international journals, and 4 books published with Elsewhere and CRC Press. He has successfully completed projects funded by UGC, AICTE, DST, ICMR, CCOST, and several other industrial projects. He has citations of more than 9,000 with an H index of 37 and I-10 index of 183 with 4,164 citations. He has 2 international and 2 Indian patents too. He is the recipient of a prestigious APTI-CJ Shishu Award for Research in Pharmaceutical Sciences 2023. The Department of Health Research ICMR Young Indian Biomedical Scientist Award in 2019, UGC Raman International Award in 2014, and number of prestigious awards at the state level for excellence in research, namely the Young Scientist Award for the state of Chhattisgarh 2006 in medical sciences. He is a life member of various for scientific and research collaborations such as National Center for Natural Products Research, School of Pharmacy, University of Mississippi, School of Medical Sciences, Deakin University, Australia, AIMST University, Malaysia, and University Sultan Zainal Abidin, Kuala Terengganu, Malaysia, and Udayana University, Bali, Indonesia. Ladies and gentlemen, please join me in warmly welcoming Dr. Dipendra Singh sir to deliver his key address with a round applause. Thank you.
A very pleasant morning to all of you. Still we are in the morning. Thank you, Alicia, for introducing me to my dear students and participating here in this hall. Indeed, a pleasure to be in this campus. Honorable Chief Guest of today's function, Professor Atul Nathaji, National President IPGA, one of the biggest professional body of India. where the pharmacy, the maximum number of pharmacy graduates are a member of that association. A very dynamic Again, we are fortunate that we are having very learned people from outside India, the scientists from Malaysia, Dr. Chan, Dr. Van, and Dr. Vijay, who came they traveled all from Malaysia to this place. So thank you all for joining in this conference on behalf of this institute and on behalf of our country. We are welcoming you here. Friends, I have addressed everybody, people who have came from different institutions, principals from different institutes, teachers from different institutes, and overall, over and above all, my dear students, budding pharmacists.
Hello.
Really to be interacting with the new people who are in my profession and trying to take their views and try to share my views that what we are thinking and what will be the fate of the pharmacy. Yesterday only the health minister said that we are already the pharmacy of the India. Now we want to be the innovator of the world. That pharmacy of the India is now the pharmacy of the world, but now he is inviting us to be the innovator of the world. So you can understand what is our target and what is the theme and what is the expectation from the new generation who is practicing pharmacy. Friends, I always start my talk and I say that we are living in the time of change. The time is changing very fast. Either you will talk about the education system, either you will talk about the existing structure, existing technologies, and the way the technology is changing. Technology is introduced, you capitalize, and suddenly you know there is a new technology. I think so. People are recently we are talking about AI, and I don't know if you have heard about another term which is came, that is SI. कितने लोग हैं जिनने SI term सुना है? SI term किसी ने क्लास में सुना है कि AI के बाद SI भी कोई term नहीं. So I am telling you, people are working since so long. They are working on SI, that is called system intelligence.
NASA sir was saying so many things he has shared, and I am telling you, we are talking about AI, and he categorically said, AI cannot dominate, they cannot take decision, we have to create. But friend, I am afraid to share with you what the SI we are coming, they are able to take the decisions. On the basis of your experiences, on the basis of different AI data, number of data, the SI will be able to take decisions on behalf of you. And one example I am sharing, the day-to-day life may we see, but we never work on. You have seen driverless car. That is an example. There you are not requiring any human being. The machine is driving itself. So this is the time is coming, and I am afraid that in the morning I was talking to you how we have to be in line with the technology. AI is not, you cannot take it lightly. There was a debate that it is good or bad. No, you cannot debate on that. You have to capitalize on it. That is the only solution if you want to survive in this competitive world. I was sharing with Chairman Saab that if you see the investment of how much, if you want to see the scope of any work or any technology, you have to see how much money is spent on that. अगर आपको किसी चीज़ के बारे में पता करना अच्छा है या बुरा है, तो आप देखिए कि पूरी दुनिया उस पर कितने पैसे खर्च कर रही है. तो just I am sharing with you what the budget in 2025, United States was having a budget of $470.9 billion US dollars. China was having a budget of 119.3 billion US dollars. United Kingdom, which is on the third, they only spent 28.3 US billion dollar. And in case, if you'll see, we are at the position of 7th and we are spending 11.1 billion US dollars. So now you can emphasize that what the technology, how this technology is important. And why I am telling you you have to capitalize on it, because I was sharing we are very happy, we are always blessed, we are blessed that we are having the highest number of young population in the world. But you assume a condition where the machines are working on behalf of you, so what you will do of your young population? So So this is a time that you have to work on the technology, you have to capitalize on the technology, and that's why if you'll see the new syllabus, I don't know how many of people you have gone through the new syllabus, not it was on a web for your suggestions. So now the council has revamped all the new syllabus, and in every semester you are having a component of AI which is the integral part of the syllabus. You have to study about that. And friends, really this technology is going to change the things. How many people you are using ChatGPT? कितने लोग यूज़ कर रहे हैं, किनके फ़ोन में इंस्टॉल्ड है ChatGPT? Almost everybody is using ChatGPT. So again, when at the same time there is a caution also. When you are using a technology, then you have to use this technology as a support, as a aid, as a companion, not as a master. Don't be slave of this technology. Be the master of the technology. Use this technology to improve your qualities, not to be dominated by that. What we are doing, the biggest problem what I used to share with the youngsters, that you are having a sufficient time for making a project which is given by your teacher, but you will spend 4 or 5 days ideal, and then you will take ChatGPT, give the prompt, they will give you the project. It's fine, and you submitted it. No, this is not right. Now you are behaving as a slave. So you have to use it as an aid only, support only, to improve your efficiency, to improve your results, to improve the precision. You can improve it, but always in a commanding position. This is the only way to dominate the technology. Otherwise, if you will be dependent on that, definitely technology will take your job. In one of the conference, one of my colleague asked, if this technology AI is coming and the companies are going to implement it, definitely the number of manpower will be reduced. I said no. Until you are not expert of that technology. He said, okay, in one company there are 5 people. Now the AI and all the technologies has been implemented in the company. Now they are requiring 1 people. So I said no. They will require all 5 people if you are qualified, if you are technically acquainted. So said how? I said the company which is working with 5 people, they were working for 1 client or 2 clients. Now they are 5 effective people, so they will be working with the 5 or 10 clients. So there is not issue that they are going to take your jobs. There is issue that you are capitalizing on it or not. अगर आप उसके साथ मिलके काम नहीं करेंगे, अगर आप उसके ऊपर कैपिटलाइज नहीं करेंगे, तो डेफिनेटली आपका जॉब कोई ना कोई मशीन लेगा. And it is happening with the pharmacy people also. You Google it, you are having phone in your hand, so many people still they are on phone. नासा सर ने भी बहुत सजेशन दिया कि फ़ोन को नहीं, लेकिन लोग इस लेक्चर में भी अपने फ़ोन को छोड़ नहीं रहे, फ़ोन देख ही रहे हैं. तो ये इम्पॉर्टेंट, आप दिस इज़ द एडिक्शन. एंड एडिक्शन आई एम टेलिंग यू, गूगल योर फोन and see the robotic pharmacists, those who are working in the world. Already the robotic pharmacists, they are existing, they are working in the hospital. So you just imagine ki what will be your role if machine will take your job. So you have to very intelligent to dominate the machines, and that is the only mantra. Why I am telling these things, the only mantra is what the course it is taught to you, what the practicals it is taught to you, take it very seriously. The mantra is very simple. जो आपका एग्जिस्टिंग सिलेबस है, एग्जिस्टिंग कोर्स है, जो प्रैक्टिकल्स है, डू इट वेरी सीरियसली. दैट इज़ द ओनली थिंग यू हैव टू डू, एंड टू बी इन द करंट what the current news is there, current science is there, current research is there, go through it. So you will be updated, you will be in line with that. So that is my first request to all of you. Sir has said that I will be sharing with you few what the initiatives we are taking at council. Friends, from the next session we are going to introduce new 5 M.Pharm syllabus. That is new courses we are going to introduce. One is M.Pharm in medical devices, that is required, and this is a new branch we are going to introduce. Another is M.Pharm in AI and drug discovery. This is the second branch we are going to introduce. The third is M.Pharm in pharmaceutical management. This is the third branch which is the PCI is going to come with that. Then fourth is your M.Pharm in pharmacovigilance and material vigilance, and might be the name can be shifted because still it is working and the scientists are working on it. And fifth one is the your biopharmaceuticals. Why? Then again the question anybody should ask, why these 5? So if you have last budget, if you have seen, a tremendous amount of money has been allocated for these areas. That is the reason that we are introducing, because when the budget is in this session it is being allotted, definitely when it will be implemented after 2 or 3 years, there will be huge demand of the people who need to be work in this area. So that's why we have introduced these new 5 branches, and again like medical devices branch, there it is a strict provision that when the institution, if any institution is trying to take this or having this course, then it is mandatory that they have to do a legal MOU with the companies who are working in the medical devices, and compulsorily the project work of the student will be in the industry. So that is a condition for that M.Pharm, because as we talk about the filling up the gap of industry and academia, I always say because when I was studying, when sir was studying and you are studying, we are talking about gap of industry and academia. But I am telling you that we have worked a lot on that. But again, the topic is again live, because situation equally the number of institutions has increased. When sir was taking he was willing to take the pharmacy courses, there less than few hundred colleges were there in all over India. When I started, there were less than 1,000 colleges in India, and right now if I will talk, it is more than 7,000 colleges in India. So you can understand that due to the increased number, the gap is always there, because equally the opportunity is not available. But still we are working on it. The Pharmacy Council of India is again coming with a very innovative provision because it is always a problem for the institution to send their student for a training into the industry, because industry is always having a limitation. It doesn't take so many students for the training. So we are trying to make a center for excellence in each and every state, and around 5 crore rupees has been allocated for each center for excellence, and that the proposal should come from the state, and we are trying to make a center for excellence which will be available for 24/7 and 365 days. It is available for the training purposes of the student, and that will be a state of art industry model. So this is one approach to ease the student, to make them familiar with the industry. We are working on it. So these are a few important things what we are doing or we are trying to do in this. All the syllabus is being revamped. PharmD syllabus is very soon, you will have a new PharmD syllabus. B.Pharm syllabus already it is being revamped, and M.Pharm syllabus, diploma syllabus, all by the end of 2026 you will have a new syllabus on that. So we are working on it, and I am sharing again, I am inviting all of you. If you are having a very specific suggestion related to your syllabus, please write to us. My email address is with Dr. Srikanth, and if anybody, my phone number is also there. If you are really willing to talk to me, give your suggestions, because fortunately right now I am having responsibility of again doing this. I am a tool to do this or changes and making new things or proposing it to you. So if anybody is interested, you can directly write to me. Still I am open for all the staff. I am teaching all the teaching staff and the student too. I am inviting you. If you have any suggestion, please write to me. Friends, if you see why I was saying every time any teacher will say you that emphasize स्वा जो बोल रहे हैं ना, हम जो बोलते हैं मैं, ये that is very important. Sir has emphasized. You say he gave you 5 things what to say in the morning, but you are very important. Until you will not understand you are important, you will be not responsible. आप मुझे एक बात बताइए, एक डॉक्टर अपने कोर्स को कभी लाइटली क्यों नहीं लेता है? आप एक डॉक्टर के पास फेथ करके जाते हैं, वो अपने कोर्स को कभी लाइटली नहीं लेता है. क्यों नहीं लेता है? बिकॉज ही नोज कि इफ़ विल मेक मिस्टेक वन लाइफ विल गो, तो वो कभी नॉन सीरियस नहीं रहता है. सेम इक्वली वी आर ऑल्सो इम्पॉर्टेंट. He is dealing with the diagnosis, you are dealing with the delivery of the medicine, you are for the prescribing drugs, you are also equally responsible. So why you people are not thinking that you are important? अगर जिस दिन आप ये समझने लग जाएंगे कि मैं इतना ही इम्पॉर्टेंट हूँ कि मेरे किसी गलत काम से किसी की जान चली जाएगी, तो you will be very serious about your studies. Sir has said कि the respect is not demanded, it is commanded. Earlier when I was studying, I was struggling to explain to the people. When I was traveling, people used to say, what you are doing? I said, I am doing B.Pharm. तो he said, B.Com करना था तो इतना दूर क्यों है, पास से कर लेते किसी कॉलेज से. तो there was not a difference between B.Com and B.Pharm. So that struggle we face. But right now this is not a situation. Specifically after COVID, people know that pharmacists are there in the society, and they were the people who are readily available to the public, given suggestion, given the medications, and government has also underlined that we played a very important role during COVID. So they asked, they invited us, they discussed with us how the pharmacists can reduce the workload of the doctors. So at the government level it happened. and finally they have accepted one proposal that each and every hospital will have a pharmacist, that is clinical pharmacist in the hospital. And I don't know ki it was expected that it will come as an order that every hospital has to appoint a clinical pharmacist in the hospital, and they will be working on the various adverse drug effect, suggestion related to prescription audit, taking the patient history and everything, keeping with them. So this was proposed. So at every level people are working. So that's why I am saying कि you people are very important. Consider yourself very important. जिस दिन आप ये समझने लग जाओगे कि मैं अगर ठीक नहीं रहूँगा तो पूरी दुनिया बिगड़ जाएगी, तो आप बहुत अच्छे से रहोगे. That is very much required. कि you are very important, आपके बिना कुछ नहीं होता है. And again I say one statement कि be selfish. आप अपने लिए काम करो, बहुत अच्छी बात है, कोई नहीं बोलता करने के लिए. लोग बोलेंगे क्या सिखा रहे हो आप, नहीं. You do for yourself. बहुत सेल्फिश हो जाओ, अपने लिए काम करो. Once you will do for yourself ना, we will take the credit. आप जैसे ही कोई काम अच्छा करते हैं, फॉर एग्जांपल जब नासा जी ने यूपीएससी टॉप किया होगा तो उनके घर में लोगों ने क्या किया, हमारे बच्चे ने यूपीएससी टॉप किया. उनके कॉलोनी ने कैसे क्लेम किया कि ही इज़ इन माई कॉलोनी एंड ही टॉप द यूपीएससी. स्टेट भी उसका फोटो लगा के बोलेगा फ्रॉम द स्टेट ऑफ दिल्ली ही माई स्टूडेंट टॉप यूपीएससी. आज आप कोई भी फॉरेन नेशनल है, दे आर वर्किंग इन यूएस, दे आर सीईओ ऑफ इंडिया, एज द पीपल फ्रॉम द इंडियन ओरिजिन, वी आर टेकिंग क्रेडिट कि ही इज़ फ्रॉम आवर कंट्री. सो डोंट वरी फॉर दैट, डू योर गुड जॉब, बी सेल्फिश. हम बाकी क्रेडिट हम सब ले लेंगे एंड दैट विल बी शेयर्ड विद एवरीबडी. सो डोंट वरी फॉर दैट कि आई एम वर्किंग फॉर माई सेल्फ और फॉर हुम. यू वर्क फॉर योर सेल्फ, दैट्स ऑल. So everybody will take credit and everybody will be benefited by that. So this is my one message. टाइम बहुत हो गया है. 5 जो सर ने 5 बातें बोली उसमें से कुछ बातें तो सर ने मेरी बोल दी, बट फ्रॉम एवरी स्टेज आई एम रिक्वेस्टिंग टू द टीचर्स एंड स्टूडेंट ऑल्सो these 5 things. First thing is always respect your parent, elders and teachers. मुझे बोलना नहीं चाहिए, ये कोई बात नहीं है जो मैं किसी से शेयर करूं, पर मैं बोल रहा हूँ क्योंकि सोसाइटी में इट इज़ एग्जिस्टिंग. समटाइम व्हेन वी आर सक्सेसफुल, समटाइम वी ग्रोन अप, सो you start to underline your suggestions of parent, you start underline suggestion of your teachers. नहीं, कभी पूरे जीवन में अगर एक काम नहीं करना है तो ये नहीं करना है, कभी भी माँ बाप बड़ों की और अपने शिक्षकों की कभी भी डिसरेस्पेक्ट नहीं करें, बिकॉज दे आर द ओनली पीपल इन दिस वर्ल्ड, दिस आई कैन से ऑन प्लैनेट, जो आपसे हार के खुश होते हैं. अगर आप उनसे अच्छा करोगे, आपके टीचर हमेशा आपसे खुश रहेंगे कि मेरे बच्चे ने मुझसे अच्छा किया. आपके माँ बाप आपसे हमेशा खुश रहेंगे कि मेरे बच्चे ने मुझसे अच्छा किया. तो दीज आर द पीपल. कौन दुनिया में कौन किसी से हार के खुश होता है? वो 3 इडियट्स याद है ना, सब बहुत अच्छे दोस्त रहते हैं, लेकिन पता है किसका नंबर आया तो आपको कितना बुरा लगता है कि दोस्त का नंबर ज़्यादा है. तो दोस्त को भी बुरा लगता है, लेकिन सिर्फ माँ बाप ऐसे होते हैं जब आप अच्छा करते हैं तो उनको बुरा नहीं लगता है. सो और एक माँ बाप की आपका रेस्पेक्ट और उनका आशीर्वाद रहता है कि आप जीवन में तरक्की करेंगे और पॉजिटिव तरक्की करेंगे. तो हमेशा एक पहला मेरा बात जो मैं पहली बात बोला. सेकेंड इज़, सर ने बोला, मैं फिर से बोल रहा हूँ, से नो टू एडिक्शन. It is not I am talking about any drug, because we are pharmacists and we know what is the impact of drugs and habit forming substances. I am talking about only the addiction of technology. अभी मैंने बोला, देखो अभी भी एक बच्ची है, कोई आपके मैनेजमेंट इतनी मेहनत करी, आपके श्रीकांत सर ने मुझे इतनी मेहनत करके यहाँ बुलाया, अभी भी अपने फ़ोन से लगी, अपने फ़ोन से खेल रही है. You just, this is addiction. This is addiction कि when you are among so many people, we are sitting with 50-100 people are sitting, somebody is talking from the stage, but still I am on my phone. This is addiction. You know there is nothing like that कि by that call or that message the world will be destroyed. You can see after 5 minutes or 10 minutes, but no, we are addicted to it. You know कि there will be a beep of email, there will be beep of SMS, but still you will take your phone. ठीक, कुछ नहीं है. We used to do it. This is addiction. एंड इफ़ यू वांट टू स्टडी प्रॉपरली, अगर आप पढ़ाई करते हैं, कोई काम करते हैं, तो अपने फ़ोन को अपने से बहुत दूर पे रखिए, उसकी आवाज़ भी सुनाई नहीं दे, ड्रॉर में बंद कर दो कि देयर विल बी नो साउंड, यू विल नॉट बी डिस्टर्ब बाय योर फोन. और दिस इज़ द रीज़न कि वी हैव लॉस्ट आवर प्रोडक्टिविटी, क्रिएटिविटी, एवरीथिंग इज़ लॉस्ट. एंड इफ़ आई, बिकॉज व्हाई आई एम सेइंग, माई किड इज़ देयर, जब भी वो फ़ोन देखता है मैं उसको मना करता हूँ कि फ़ोन नहीं देखना, तो व्हाट ही यूज्ड टू से, नो आई एम वेरी सीरियस अबाउट, आई एम टेकिंग ए वेरी सीरियस कंटेंट. तो जब आप रील देखना स्टार्ट करते हो तो आपको लगता है हम सब काम की चीज़ तो देख रहे हैं, बट इट किल योर टाइम. आपका वो किसी काम का नहीं है, क्योंकि वो आपसे आपके प्रोग्रेस में आपको पार्टिसिपेट नहीं. ओके फाइन, यू आर गेटिंग सम इन्फॉर्मेशन, बट हाउ दैट इन्फॉर्मेशन इज यूजफुल और नॉट. पर आपको अट्रैक्ट करता है, आप देखते रहते हैं, आपके कब 3 घंटे निकल जाते हैं आपको पता नहीं चलता है, और आपने अपने ज़िंदगी के 3 बहुत इंपॉर्टेंट घंटे उस फ़ोन पे बर्बाद कर दिए। सो अगेन माई रिक्वेस्ट कि मेक अ डिस्टेंस फ्रॉम योर फ़ोन, create no phone hour, no phone day, then only you will be very effective. Okay, fine, I am saying कि use the technology, but when it is required. आप कभी एयरपोर्ट पे कभी आप ट्रैवल करते हैं तो आप एयरपोर्ट पे जाइए, you will see the right situation. अगर आप कभी सीढ़ी से नीचे उतरेंगे तो आप देखेंगे ऊपर से अगर आपकी नज़र नीचे जाएगी, अगर हॉल में 200 लोग बैठे होंगे तो 200 लोग में से कम 190 लोग ऐसे करके देख रहे होंगे। एंड दिस इज़ अ रियल सिचुएशन। Nobody used to talk to anybody, they are not bothered about who are you। और मैं सबको बोलता हूँ कि अगर आपके फ़ोन में बैटरी नहीं तो कुछ घंटे आप रह सकते हैं, फ़ोन में बैटरी है तो जब तक ख़त्म नहीं होगा तब तक आपको किसी की ज़रूरत नहीं है, और चार्जर अगर है तब तो कोई बात ही नहीं है। तो अभी तो हम खाना भी फ़ोन से मंगा ले रहे हैं, दोस्ती भी फ़ोन से हो जा रही है, और बहुत सारे लोग तो शादी भी फ़ोन से कर रहे हैं। सो दिस इज़ आवर डिपेंडेंसी। So by in a lighter mode I am telling you, but try to make distance from your phone while you are studying, then only you will be very effective। क्योंकि वो हमको बहुत डिस्टर्ब करता है, हमको बहुत जो आपके रियल काम में आपको डिस्टर्बेंस होता है कि आपने पढ़ाई कर रहे हैं, किसी का इंस्टाग्राम पे मैसेज आया, आपने एक इंस्टाग्राम का मैसेज दिखा, फिर उससे कनेक्टेड एक और मैसेज दिखा, और आपको पता नहीं चला कि मेरा 1 घंटा कब ख़राब हो गया। ओके, 1 घंटे बाद उसको देखेंगे, जब मेरा पढ़ाई ख़त्म हो जाएगा तब देखेंगे। तो अपने फ़ोन को दूर रखें। दिस वॉज माई सेकेंड एडवाइस। थर्ड एडवाइस इज़, सर ने वो भी मेरी बात बोल दी है, इट इज़ वेरी डिफ़िकल्ट टू टॉक अबाउट आफ्टर अ वेरी सीनियर एंड लर्नेड पीपल। तो मेरी तीसरी एक इंपॉर्टेंट बात है, बीइंग ए फार्मासिस्ट इट इज़ एक्सपेक्टेड दैट वी शुड बी वेरी हेल्दी। व्हाई आई एम टेलिंग यू, द पीपल हु आर कमिंग टू यू फॉर एनी टाइप ऑफ सजेशन, दे आर ऑलवेज इल, दे आर इन प्रॉब्लम, दे आर इन देयर सम अनईज इज विद देम। तो उनकी जो साइकोलॉजी होती है वो बाकी पब्लिक से बहुत अलग होती है। एंड इफ़ अ पर्सन हु इज़ गिविंग सजेशन टू हिम, ही इज़ ऑल्सो अनवेल, so what will be the impact? So it is always expected from a pharmacist that they should be mentally and healthy, very fit. This is the requirement of your profession. Personally what sir has said कि maybe you will make any type of progress, आपने ज़िंदगी में बहुत तरक्की कर ली, बहुत पैसे कमा लिए, सब कुछ कर लिया, और आपका हेल्थ अच्छा नहीं है, आप किसी भी चीज़ को यूज़ नहीं कर सकते, किसी भी चीज़ को यूटिलाइज नहीं कर सकते हैं। मैं बोल रहा हूँ आपने बहुत पैसे कमाए, बहुत बड़े आदमी बन गए, और आपको लाइफस्टाइल डिजीज़ है, आपको डायबिटीज़ है, आपको हाइपरटेंशन, तो ना आप खा सकते हो ना रह सकते हो। सो इन दैट वे योर हेल्थ इज़ वेरी इंपॉर्टेंट, और इस हेल्थ को मेंटेन करने के लिए एक मेरा बहुत छोटा सा सॉल्यूशन है कि ओनली गिव 45 मिनट्स टू योर हेल्थ। सर ने तो अल्टरनेट दिया, मैं अल्टरनेट बिल्कुल नहीं देना चाहता हूँ। कोई जब आप बोलोगे सर हमारे तो सीढ़ी नहीं है तो हमारे लिए काम ही ख़त्म हो गया। सर तो फॉर्चुनेट थे कि ही वॉज हैविंग 9 फ्लोर्स। अब हम अगर रूरल एरिया में रह रहे हैं तो हमको 9th फ्लोर तो खोजने के लिए बहुत मुश्किल होगा, तो सीढ़ी चढ़ना ही नहीं तो काम ही खत्म हो गया क्या। सो देयर इज़ नो ऑप्शन ऑफ एक्सरसाइज। जो तुमको अच्छा लगता है, वॉक करना, दौड़ना, तैरना, खेलना, योगा करना, जो भी अच्छा लगता है, ओनली गिव 45 मिनट्स। 45 मिनट है, दैट विल कीप यू हेल्दी मेंटली एंड फिजिकली, यू विल बी फिट। दैट इज़ अ ऑटमोस्ट रिक्वायरमेंट ऑफ योर प्रोफेशन टू। आपके पर्सनल रिक्वायरमेंट तो है, ये प्रोफेशनल रिक्वायरमेंट भी, इसलिए मेरा आपको ये थर्ड रिक्वेस्ट था। चौथा एक बहुत इंपॉर्टेंट मेरा रिक्वेस्ट है, वी ऑलवेज कंप्लेन फॉर द एनवायरनमेंट दैट नाउ द एयर इज़ नॉट ब्रीदेबल और द सिचुएशन इज़ वेरी वर्स्ट। हम दिल्ली में पढ़ते हैं, बाकी जगह पढ़ते हैं, तो मेरा उनसे क्वेश्चन रहता है कि क्या ठीक है ख़राब हो गया, आप क्या कर रहे हो उसके लिए, आप क्या करते हो? तो देयर विल बी नो आंसर। मैं भी फिर से पूछूंगा कि आप क्या करते हो हवा ठीक हो जाए। हम कुछ करते हैं? हम कुछ करते हैं क्या हवा ठीक करने के लिए? हम नहीं करते हैं। सो आई एम गिविंग यू सॉल्यूशन कि वंस अगर कोई आपसे पूछेगा तो एक बहुत सिंपल सा ऐसा सॉल्यूशन है कि आप हर साल अपने लिए एक पेड़ लगाइए और उसको बड़ा कीजिए। आप बोल पाएंगे, जब आप मेरी एज में पहुंचेंगे तो बोलेंगे मैंने 30 पौधे लगाए, 30 पौधे मेरे बड़े हो गए हैं और मैं जितना कार्बन इमिट करता हूँ उससे ज़्यादा ऑक्सीजन उसको इन्वायरमेंट को रिटर्न करता हूँ, तो दैट वाज माय रिस्पॉन्सिबिलिटी, आई फुलफिल्ड इट। तो ये मेरा सबसे छोटा आंसर है। ये प्रॉब्लम है, उसका सॉल्यूशन भी मैं आपको बता रहा हूँ। सिर्फ आपको एक पौधा लगाना है, उसको बड़ा करना है, और चाहें तो उसका रिकॉर्ड रखिए। मे बी समवेयर अगर आप 30 साल तक रिकॉर्ड रखते तो लोग आपको इसके लिए प्राइज़ देंगे कि आपके पास रिकॉर्ड है कि आपने 30 पौधे बड़े कर लिए हैं। तो एक बहुत छोटा सा प्रॉब्लम और सॉल्यूशन। फिफ्थ और एक बहुत इंपॉर्टेंट बात है, दैट इज़ कनेक्टेड विथ योर अगेन लाइफ स्टाइल एंड लाइफ। start inculcate. If you are reading, very good. If you are not reading, inculcate the habit of reading books. आपको हर जगह पे बोलेंगे लोग, मैं फिर से बोल रहा हूँ, किताब पढ़ने का, नई किताब पढ़ने का इम्पैक्ट बहुत डिफरेंट होता है. अगेन माई रिक्वेस्ट इज नॉट फ्रॉम द फ़ोन. अपना फ़ोन दूर रख दो. सोने के पहले जो बुक अच्छी लगती है, हिंदी, मराठी लैंग्वेज, न्यूज़पेपर, कुछ भी अच्छा लगता है, उसको आप पढ़िए. आप सोने के पहले अपनी जो आपको जितना इंटरेस्ट होता है पढ़ने के पहले उसको पढ़िए. अगर आप पढ़ के सोएंगे तो सुबह बढ़ के उठेंगे, अधिक नॉलेज के साथ उठेंगे, तो आपकी पर्सनालिटी, रात की पर्सनालिटी, सुबह की पर्सनालिटी इम्प्रूव पर्सनालिटी होगी. सो दैट इज़ माई 5th रिक्वेस्ट. और चूँकि 2 रिक्वेस्ट मेरा नासा सर ने पहले बोल दिया था, तो मैंने 3rd एक और ऐड कर दिया, 6th और ऐड कर दिया इसमें. दैट इज़ वी गॉट द अपॉर्चुनिटी टू स्टडी, रीड. और हमको सोसाइटी ने, हम शायद इतने सक्षम हुए कि हम बैठ के कॉलेज में पढ़ रहे हैं, लेकिन अभी भी बहुत सारे ऐसे लोग हैं जिनको पढ़ने के लिए अपॉर्चुनिटी नहीं मिली, वो पढ़े लिखे नहीं हैं. तो पढ़े लिखे होने के लिए हमारी सोसाइटी में एक सिंपल सी रिस्पॉन्सिबिलिटी है. आप साल भर में एक व्यक्ति को टारगेट कीजिए, उसको साक्षर बनाइए. एक सिंपल सा काम है. आप साल भर में आपका क्या है, तो आप जो मैंने 5 बात बोली, आपके पर्सनल के लिए, फैमिली के लिए, एनवायरनमेंट के लिए और सोसाइटी के लिए आपका कंट्रीब्यूशन होगा, जिसको कोई डिनाई नहीं कर सकता. आपके पास डेटा है, आप बोलोगे कि हर साल मैं एक बच्चे को पढ़ाता हूँ, एक बच्चे को साक्षर करता हूँ, जिसको पढ़ने लायक बनाया, दैट इज़ योर कॉन्ट्रीब्यूशन टू द सोसाइटी. आप पौधे लगा रहे हैं, एनवायरनमेंट को कंट्रीब्यूट कर रहे हैं. अपने लिए आप अपने आप को हेल्दी रख लें. माँ बाप को अगर आप बहुत अच्छा रखते हैं, अगर उनकी रेस्पेक्ट करते हैं, सीनियर्स की रेस्पेक्ट करते हैं, आपके घर का एटमॉस्फेयर हमेशा बहुत अच्छा रहेगा, एंड यू विल बी वेरी हैप्पी. सो दीज आर माई फ्यू रिक्वेस्ट. इफ़ यू विल इम्प्लीमेंट, डेफिनेटली यू विल फाइंड चेंज इन योर लाइफ. So I think so already I have taken much of time. So thank you Ramdas ji for inviting me in this campus, giving opportunity to interact with you. I am very thankful to Shrikant also, and there is one more person who was she was responsible. So might be he might be to Revati, he will be acknowledging कि she was also she is colleague of Dr. Shrikant, and she was very willing that we should come to place. This is a beautiful campus and we should visit this campus. So thank you to her also. So thank you once again for inviting me here. Jai Hind, Jai Bharat.
Thank you so much, sir. Now I request Honorable Professor Ramdas sir, Founder President of Dattakala Sanstha, to address and encourage our participants.
Good afternoon to all of you. First, I welcome our today's chief guest, Dr. Atulji Nasa, Dr. Dipendraji Singh, and our resource person from Malaysia, Dr. Chan Soik E, Dr. Yanji Kok, when Dr. Vijay Kotra, and our secretary Somaya Chor, our principal Dattakala Institute of Pharmaceutical Science and Research Jyoti Zavde ma'am, another principal Jedge sir, our campus CEO Dr. Babar sir, and all the guests on the dais and before the dais. As a part of this today's international conference on innovation in pharmaceutical life and forensic science, bridging classical knowledge with modern technologies, we arranged the guests for sharing their experiences, plenary lectures, sessions by eminent international and national speakers for academicians, research scholars and students to upgrade their knowledge as per the current trends and advances in pharmaceutical research. In this regard, I thank all the guest eminent resource persons for accepting the invitation and coming all the way from Malaysia, New Delhi Raipur, Pune, Hyderabad to deliver valuable inputs. Totally 822 participants were registered, including both offline and online mode, for this international conference from more than 105 pharmacy and other life sciences organizations of various colleges across India. We also arranged poster and oral presentation sessions to explore sharing the knowledge and various topics. I congratulate the team of Dattakala Shikshan Samsthas, Dattakala College of Pharmacy, Dattakala Institute of Pharmaceutical Science and Research, Anusaya Institute of Pharmacy and Dattakala Institute of Pharmacy Ketur for organizing this international conference. I wish all the delegates to grab the inputs from the sessions of eminent guests and resource persons. Thank you.
Thank you, sir, for your constant support and guidance. So, today we are privileged to have the esteemed principals and professors from different colleges with us. So, we shall felicitate them to express our heartfelt appreciation and respect. So, I request Honorable Professor Ramdas Jhol sir and Mrs. Maya Jhol ma'am to felicitate and welcome Dr. Amit Panaskar sir, Principal of Padmini College of Pharmacy, and Mrs. Bhagyashree Panaskar ma'am, Vice Principal of the Padmini College of Pharmacy. Thank you, sir. Now I request Honorable Professor Ramdas Jhol sir and Maya Jhol ma'am to felicitate and welcome Dr. Ravi Virazdar sir, Principal of DSSS College of Pharmacy.
Vishal sir. Not mic tension.
Thank you, sir. Thank you, sir. Now I request Dr. Zedge sir to felicitate and welcome Dr. Yashwar sir, Padmini College of Pharmacy.
कुणाला त्यांना वर नाही घेऊन जायचं, इथंच करतोय खालती.
Thank you, sir. Now I request Professor Amit Ponkule sir to felicitate and welcome Professor M.M. Swami sir.
And we are happy to express that the total number of 223 abstracts was selected. Abstracts were selected for this international conference, and all the abstracts were published in the souvenir book with the help of Akinit Publications, and we got the ISBN number as well as DON number. And thank you. Digitally, we are going to show the ISBN number and the book publication of all the abstracts. So now I request the other dignitaries to switch on the abstract book releasing ceremony.
Thank you all of you. Then I request Professor Amit Pankule sir to felicitate and welcome Professor Hemant Bansode sir. Thank you sir. I request Amit Pankule sir to felicitate and welcome Professor Vipul Trivedi sir. Now I request Dr. Zedge sir to felicitate and welcome Professor Ram Nikhate sir.
झाले ना असं त्यांना करा ना, जावळे मॅडमला सांगा या दोघींचं करायला घ्या, दोघींना एकत्रच बोलवा. हां दोघींना बोलवा एकत्र, नाही तर खाली अडसून मॅडमला करायला लावा, काय नाही प्रॉब्लेम.
I request Professor Tejaswini Arsu ma'am to felicitate and welcome Priyanka Rathi ma'am and Shilpan Yogi ma'am. Thank you all of you. Now I request all the dignitaries on the stage to please take a seat in front of stage as we are going to continue our next session. Now we will proceed to our first lecture session of this international conference. At this instant, I believe we are fortunate to have such a distinguished, knowledgeable speakers, and I promise that this session will be beneficial to all of you. So I request Alisha Sheikh ma'am to introduce our first speaker, Dr. Chan Seok E ma'am.
Good morning, respected dignitaries, distinguished delegates, faculty members, researchers and dear students. I, Alisha Sheikh, it's my honor to welcome you all to the second international conference once again. It's my great pleasure to introduce our distinguished eminent resource person, academician and researcher whose career reflects the spirit of this conference is Dr. Chan Seok-Yi. Currently serving as an associate professor at the School of Pharmaceutical Sciences, University Sains Malaysia, Penang, Malaysia. Dr. Chan is a fully registered pharmacist and a member of academic staff and program chair of Discipline Pharmaceutical Technology in the School of Pharmaceutical Science, University Sains Malaysia. She did her PhD in Pharmaceutical Technology, University of East Anglia, on the development of PPP-based solid dispersions using hot melt extrusion for the preparation of immediate release formulations. She holds a number of research grants including international grant, industrial as well as government grant for research. Dr. Chan has published various publications and credibility and sustained research impact. Dr. Chan has played a pivotal role in advancing scientific leadership and youth engagement through her involvement in the Young Scientist Network and the Global Young Academy. Within her expertise, she was awarded the Asian Young Pharmacy Award for outstanding achievements in pharmaceutical sciences. She chaired the Science Leadership Working Group in the Young Scientist Network. In collaboration with the Higher Education Leadership Academy, Dr. Chan hosted a Women in Science Forum to empower female scientists. A visionary, she established her own research group which is named of Third Formulation Lab. In the field of pharmacy, Dr. Chan is the editor-in-chief for Malaysian Journal of Pharmacy. She has been actively involved in Malaysian Society of Pharmaceutical Technology as management team as well as the Malaysia Pharmacist Society. Dr. Chan's expertise lies in the pharmaceutical sciences, particularly on the product development, analysis, as well as next generation manufacturing method such as instant dissolvable dosage form via electrospinning. Due to her impactful contributions, she is now co-chair of Global Young Academy and
So you all heard about electrospinning. So you just feel heavy not to take your hands up. Has anyone not heard about electrospinning? Anyone? Okay, wait. How are you? Okay, so can you understand my English? Okay, so I just share a little bit with you about the journey of how I delved into electrospinning. My PhD was actually from the UK, where I studied about solid dispersion. Okay, very much looking into the thermal analysis between crystal and amorphous structure. Okay, and my field is mainly focusing on pharmaceutical technology. Is that so far okay, my English? Yes, okay. So when I first get back into Malaysia and I become the lecturer in University Science Malaysia, I was introduced by one very experienced professor on electrospinning. And then I started to work on electrospinning, and these are the few dosage forms that I have been working through. Because my previous PhD was actually focusing on oral medication, and what I am working on is actually poorly soluble drug that is not soluble after you have taken into your body. If they are not going to absorb, there is no effect. Am I right? Yes. So my aim is to increase the solubility, and one of the way that you can use is actually by electrospinning. And from there I started with oral medication and having my own published paper in 2016 on electrospinning itself. The purpose is to improve solubility, facilitate swallowing, and also taste masking. So what is electrospinning? You know the electricity loop that you learn in your secondary school? When you switch on, then you see the light on. When you switch off, the light off, right? That is electricity loops, all right? So now, I have a voltage generator, like a switch, okay? And this, the whole thing like this is a loop, okay? It's a loop. But because I have a space here, and here is a conductive plate, okay? It can draw the electron. So when I have my syringe, and I put my drug solution, and then I charge them with the voltage, and the solution here becomes charged, right? It will be drawn to the plate, okay? And this plate, the whole thing, it will be grounded on the earth, all right? So it will close the whole electricity loop. So what happens is, when you have the solution here, charge, right? When you have the same charge, negative and negative, what happens? Repulsion or attraction? Repulsion, right? So when they repel, means all the solvent molecule is trying to escape, okay? When you have solution here, but when you go here, it becomes solid, because all the solution molecule repel to each other, and they will evaporate to the air in the middle of here, right? This is the whole principle of electrospinning. So let's say if we don't have enough good machine, okay? In my lab previously in Malaysia, we are trying to buy the voltage just very cheap, 300 ringgit, and we have our own needle tip, and we have the tray, you know the tray just now that we bring the drinks, just as a collector. So you close the whole loop, and you need to have a few wire like you did in your secondary school for the switch, and you can actually create the whole setup of electrospinning. But that is lack of safety. Just to be cautious, if you are very good in, you know, taking care about all the detail, it's okay. You can actually run as such. But otherwise, you will need to have the safety to, you know, not get electricity shock, right? So this is one of the early research that I have done. And the drugs that we are using is actually Atovecon. It's an anti-malaria drug, okay? And that drug has a very low, poor solubility. Okay, so we have successfully increased the solubility about twofold. Okay, this is the blue color one, is the solubility of the drug film, and we found that the product that we got is actually amorphous. You know what is the difference between amorphous and crystal? You know crystal, shining, they arrange in the same way, right? But when you dissolve them, means all the molecules are going randomly, correct? Random, okay? And you remove their solvent in a very quick manner, just now electrospinning. So all the molecule was actually freeze. You know, you like when you were small, you have a game that you are running, and then people say stop, and then you will stop. So these are what happened in the molecule of the electrospinning. So whatever molecule in that condition is actually in the form of amorphous, because they do not have time to become crystal again. So hence my X-ray diffraction shows that they are amorphous. Amorphous means when you have a solid, that is amorphous, and when you dissolve in water, they do not need many times to dissolve, because there is no bond to break. No bond to break. They can dissolve very quickly. So that is the advantage of amorphous. So for electrospinning, the work it does is just to create all the drugs become amorphous and enhance solubility, right? Okay, and what we see here, if you look at this one here, if your viscosity is very high, so what you have is actually like a line of fiber, like the spaghetti that you have. You actually draw them like a spaghetti. But if your viscosity is very low, or your surface tension is very low, it will become particle, like spray drying. Have you heard about spray drying? Like you spray your, you know, the atomizer when you use during the COVID time to spray yourself to get clean. You know, those small droplets, and they become dry and they become particles. Those become powder. So it can become powder, and it also can become fiber. Okay, so that is one. So in the scanning electron microscope, this is what you will see. So they are becoming fiber with a very high surface area. And this is permeability. Because this drug, when we are making them, they become in the plate, right? They collect in the plate, it becomes a film, like a tissue paper. You know tissue paper when you peel off? Just like that. And when that are like a tissue paper, and how do you take it? They are not tablet anymore. They are like a paper that you put in your tongue. Okay? And that is beneficial for places where you don't have enough water sanitation, or you don't have enough water. Okay? And if you put into your tongue, it's simply the saliva is enough for you to dissolve your drugs. Okay? So that is one of the innovations that we are looking into. Okay, in near to 2019, okay, after I got my previous project as successful, I got Global Research Translational Award from the UK Global Research Fund to actually tackle malnutrition in Malaysia. So because my expertise on electrospinning, so what I did was, I am actually taking the palm oil, which is famous for Malaysia. Okay, they have beta carotene, which is a source of vitamin A, and do electrospinning. So hopefully the children, they no need to swallow any tablets, so that they can take the tissue and put it in their mouth and dissolve. That is also one of the intention of this dosage form. In my life, I have a lot of young people like you guys, because I believe I like them to be very energetic, and they like to, you know, think whatever possible, okay, without giving them a lot of limitation. But anyway, this young man failed all the experiment, okay, and we found that viscosity play a very critical role if we want to have a good electrospinning film. So then another young man, which is the partner of the guy just now, he found out that in the electrospinning chamber, we have a chamber. After we run for some time, we see this thing. You know, it's like there is some tree growing inside the machine. Okay? But apparently, because when I need to use palm oil, put into the syringe for electrospinning, you know oil, how do we make the oil become a solution? Unless the oil unless the oil it is able to spin. Usually it is not able to spin because we need to add polymer. You know polymer? Do you know polymer? The molecule with a very, very long chain, right? The oil itself, like the cholesterol structure, is not enough long to be spin. Okay? So what we do is we have to make them into emulsion. Do you know cod liver emulsion? One that you actually drink when you were younger. I don't know if you drink, but yes. So typically what I did was making them like a cod liver oil emulsion using polymer plus the oil, then I do electrospinning. And from there, when I see this, it's obviously there is a phase separation. You know emulsion problem? What is the problem of emulsion? Phase separation. So when you have a phase separation, then the whole syringe, the solution inside the syringe becomes not stable anymore. So it is not suitable to be spin. So this is something that we found out, and this guy, he came to me with a lot of sweat and say, you know, doctor, we fail again. You know, whenever I see the student fail, inside of me is happy. Outside of me, I have to show, oh, you fail. The reason being, because I know every failure has a novelty. There must be something to explain behind that failure. I'm happy because whenever students tell me something new, some failure means something new behind. And his work is successfully published in one of our review papers. We review all the different journals. Then we think that in a good paper should have something new to tell the audience. So this is something that we actually tell our audience, that if you electrospin emulsion, that is a very tricky task. And we show also this picture in that particular journal. You can search about it, then you will find us. And of course, his name is inside. Being an undergraduate student, he feels very satisfied even though after the failure. So this is his work. Oh, sorry. So eventually we are thinking about folding them into like candy for the small kids. Because vitamin A, you need a big dose, so we need to fold them into many layers for the kid consumption. But that is just an ugly prototype. It has not been actually sold in the market. Or you can actually have something like this, a product like this. Okay. So in my lab, I was fortunate or unfortunate. Actually, electrospinning in the pilot scale, in the bigger scale, in Malaysia, we don't have one. Okay, but we have one big machine in medical device industry, which is based in Germany. Based in Germany, they have a plant in Malaysia. But the fact that this company want to revamp, so they have no expert to work on the pilot scale, and they asked me, Dr. Chan, can we give this to you, the whole big machine, and we support your research. And this is where we got the big scale of electrospinning, and we found that because just now when you see a small needle, how long you want to wait for the whole film to finish, right? It will be very long. So for the big scale, it is actually 70 times more efficient. And this is always like Dr. Atu or your distinguished keynote speaker has been mentioned to you, the gap between the academic and industrial. The industrial will not be interested if something is not efficient. They want to be fast to have the products. So hopefully this is a solution to that. So I have also another product which is papaya leaf. Do you know papaya leaf? Okay, do you know what do you use it for? In Malaysia, we have a policy that papaya juice, leaf juice, can be used for adjuvant treatment for dengue. You know dengue? The one mosquito bite? Dengue. Yeah, what do you call it? Dengue. Yeah. Okay, so we drink this juice, okay, but it has to be fresh. And in the Institute Medical Research of Malaysia, they give us the procedure, how do you make the juice. And if you read it properly, there is no heating involved. You cannot cook the juice with the leaf, like how you cook for the extraction or how you cook for the soup. No, they say you have to wash it and you smash it and you take the juice as much as you can, right? And this is a trick that I'm seeing because electrospinning, just now you say the whole process involves heat or not? Is there heat for electrospinning? Okay, for the whole electrospinning you have voltage, you have the needle, you have the collector. Is there any heating involved? Heating. Actually there is no heating involved. So I can actually formulate this into dosage form. Because whatever product that I search in Malaysia that is registered, there is no claim of how effective is their products. No claim. Okay, they just, because of Institute of Medical Research recommend that, so they just do a product without much claim. So what I was trying to do is I'm using electrospinning to formulate the papaya juice. But papaya juice, after you made it, is very, very bitter. You know what's bitter? Yes, very bitter. So what I have is coaxial electrospinning. You know, like coaxial means there is one needle, and middle there is another needle, two needles. Okay, when you have coaxial, the one in the middle can be something bitter. The one from outside you can put some sugar coating or whatever that you like. And once they are spin, then they will be dried off. Okay, so that is the project that we were using, and we do also human testing. And of course, overall, all of our sample, they say the coaxial electrospinning is much better than the one without coating. And of course, my student, this is the student who has been doing this, and we won a few awards in a regional competition. Okay. Right, this is another one. This one, okay, I can give you a very good trick. It's very easy for you to duplicate. This is paracetamol. Do you know what's paracetamol? Yes. Paracetamol in essence actually very bitter. So I use the same way, coaxial electrospinning, put inside. Inside is bitter, outside is, what do you call it, the taste better. Okay. So we also got, you see, this is by second, first second, second, third second. By 3 seconds, the whole film disappears. And this is where we are trying to sell the products this way. And again, my student winning that award. Okay, I'm not going to go through this one because it's too much for undergraduate actually. So we also pitch to funder, we pitch to company. We call it easy kit because it's easy for the kids to take it. And if you are children, your paracetamol is not whole tablets, right? You have to take it, I don't know, by measuring syrup, correct? But if you use this one, you can actually cut just smaller region. For year 1 or year 2 is different. You know, you just cut based on the weight that you need. Okay? Yeah. This is just concept. And this is also another product that we has been working and it has been completed. Just a show for you. And this student also won the first in the research competition. Okay, this is a very, very recent one. Just now that you see, most of the things that I did was here. Okay? And this student working this one. So just now I told you coaxial electrospinning is the one in the middle and outside, right? And become a fiber. And this student, when he is doing the spray powder. But we are playing with the surface tension. We know what kind of surface tension they can become powder. So what happened is you have the interior and exterior. Like the liposome or nanosome that you do, but you see liposome or nanosome are spontaneous process, a process that you have to make them and they have to, you know, invert or outward spontaneously. But this one, electrospinning is deliberately, you can tell which one you want to put inside, which one you want to put outside, and you can get this kind of powder, okay, with 2 layers. And this is the result of the release. So in the first few time point, then it released, you know, because this particular student, the outside he put pH dependent polymer. You know what is pH dependent? Mean only certain pH it will dissolve. High pH it dissolve, low pH no dissolve. Stomach low pH or high pH? Stomach low pH or high pH? Stomach high pH. This side, in stomach you have low pH or high pH? Huh? High pH. One more time. Stomach low pH or high pH? Intestinal, high pH or low pH? Sorry? Okay, stomach pH, this is true or false? Stomach pH is about pH 1.2. True or false? True, yes, true. Okay, so stomach usually is low pH. Okay, and intestinal is high pH. So when we coat with the pH dependent polymer, means this drug when you go to stomach it doesn't dissolve, right? It go to intestine only dissolve. Why? Because intestine is the biggest surface area for drug absorption. Okay, most of the drug they doesn't absorb in stomach. Okay, all right. Anyway, yeah. So this is some, you know, whatever that I have done just now. This is the market value of those things that actually you can gain if you venture into this research. Okay. Okay, next I would like to tell you a little bit about wound. In my research group, we also work about wound. Okay, we have some herbal extraction and we do electrospinning. It becomes a tissue and we make it many layers and you can actually cover as like a wound. Okay, this is cashew leaf extract. Okay, and this one is a very interesting one, which is zinc oxide nanoparticles. Okay. This is also for wound, but we have to synthesize the zinc oxide first, okay? Okay, if you look at here, this is zinc oxide powder for antibacterial. And you have Staphylococcus aureus, Staphylococcus, E. coli, Pseudomonas aeruginosa. This is all the bacteria. You come across bacteria before? Okay, tell me, which one Staphylococcus is gram-positive or gram-negative? Oh my God, this is a class. Never mind. Okay. So it was these two is gram-positive, and the later one is gram-negative. Okay, gram-negative. But you see, zinc oxide nanoparticle is very effective for gram-positive, right? Which is the first two. Okay. But after I take the zinc oxide and make it into electrospinning, what happened? So this is still powder alone. This is all electrospinning, the first three. You see, the effectiveness for gram-negative has increased. Okay, this is gram-negative. Okay, so just now, gram-positive is more effective, right? When it is powder alone. Okay. And when you become an electrospinning, gram-negative become more effective. But why? The polymer that we use is cellulose acetate. This is also fresh from oven that we haven't published the data. Okay, but we found that electrospinning is more effective after compared to the pure powder alone. So the reason being, you know, gram-positive and gram-negative bacteria. Okay, on your surface of your skin, you have gram-positive or gram-negative bacteria? Gram-positive usually. Okay, but let's say if you are diabetic patient and you already have wound, okay, for some time, you will potentially have more gram-positive or more gram-negative. Okay, it's okay, I can give you the answer. It's more gram-negative over time. This is chronic wound. You have gram-negative, okay? But electrospinning show you that after you make the zinc oxide nanoparticle become electrospinning, you can actually more effective on gram-negative. And this is also again one of the selling point that we are targeting for diabetic wound patient for these particular products. Okay, you can have this. You know what is the reason? Cellulose acetate is actually a little bit of pH dependent. You know what is pH dependent? Means certain pH only it will break. Gram-negative bacteria, okay, they will give you some watery, right? And that water is actually alkaline, okay? And it will cause cellulose acetate to release, okay? But if acidic cellulose acetate is intact, it is not released, all right? Okay, this one is, you know, when you have pimple, do you have experience of having pimple? All right, those who are very severe on pimple, you not only apply on the tretinoid and you need to take medication, serious one, and that medication is called isotretinoid. And this medication is actually very bad for the skin. And woman that is pregnant, you actually cannot take this medication. Okay, and we are trying to make this into electrospinning again. And you see the one in the circle showing that our electrospinning medication is more effective. Yes, thank you, thank you. So we have also tried to run on the skin of the animal. Let's say if you have only the medication that you apply using this isotretinoid, you will have these rashes like this one. But after you have made into electrospinning, which is using the palm oil, then we have a better skin. Okay, we don't have the pigmentation like this. Okay. Okay, so this is another student who are working on the acne. So she is only focusing about the market analysis, like whether you like it or not, because this patch, when you put it on your pimple, it will disappear. There is nothing that you need to throw, because just like the one that you put in your mouth, it will dissolve, right? This one you put on your skin, it will dissolve, so it will go into your skin, right? Okay. So my innovation has been ongoing. So my current research is on stability and also on packaging. okay, because it absorbs water very quickly, so stability is always the problem. If stability cannot be resolved, this is the gap for industry, as I said. And this is all my superstar in my lab, okay. Whatever they are presented is not the work that I have done alone, it's the work that I have done with many different superstars here. And I would like to thank the organizer. And that's all. Thank you very much. Thank you. I offer.
This one.
Oh yeah. How long did I talk? Is it long?
Thank you so much, ma'am. With that, we conclude Dr. Chan ma'am's presentation. Please join me in giving a big round of applause to her. Thank you, ma'am, for your insightful presentation. We now open the floor for question and answers. So I request all the participants to ask the questions without any hesitation. Anyone have a question or doubts? Yeah.
Good afternoon, ma'am. First of all, I would like to say most welcome in India, both of you. And your research topic is very nice and informative to us also. Madam, my two small question about this. Madam, in your formulation, you surfactant use twin AT. Instead that, can we use DMSO, dimethyl sulfoxide, for quercetin or flavonoid-like substance?
Thank you. Yes, I use most of the time twin AT. DMSO I have not tried for electrospinning, but I did try for some other extract which looked successful, but not under electrospinning. That was just a freeze drying formulation.
Okay, thank you, ma'am. And one more question is, in banana leaf extract, at that time I was excited, there are some heavy metals find. Madam, in case we try to extract or isolate with zinc oxide nanoparticles, it is trouble with it or heavy metals and react with it.
We have not actually, in my formula, we have not test for the heavy metal. It could be possible that there is there. But yeah, my answer to this is I'm not very sure.
Okay. Thank you so much, ma'am.
Anyone have a question? Okay. Thank you, ma'am, for sharing your valuable expertise. It was a very informative session for us. So, it is our great privilege to extend a warm welcome to our esteemed press and media members who have graciously joined us today for this international conference. So, I request Professor Amit sir to felicitate and welcome Mr. Tal-Daund sir, Sakal newspaper, Punyanagari newspaper. Tal-Daund sir. Thank you, sir. Now I request Professor Amit sir to felicitate and welcome Mr. Harshavardhan Gade sir. sir. Now I request Professor Amit Pongule sir to felicitate and welcome Mr. Siddharth Wagmare sir, Sangharsh News. Thank you sir. I request Professor Amit Pongule sir to felicitate and welcome Mr. Prashant Bhosle sir, Private News. Thank you, sir. Now, dear participants, for the next session, the attendees are welcome for a lunch break. Lunch will be served at mess hall. Please note that after the lunch break, there will means at 2:15 p.m. there will be poster and oral presentations, and our second plenary lecture start sharp at 2:15 p.m.
येऊन काय यायचं लवकर त्याचा आज किडा मिटावतो आता काय होत आहे त्याला बघतो त्याच्या साऊंडला प्रॉब्लेम आहे की आपल्याला प्रॉब्लेम नाही आपल्या मग माईकवर नावाचं चालला नसतं आपल्या केबलला नाही प्रॉब्लेम त्याचे तिथून ऑडिओ आउटच होई नाही